Right. Hello and welcome, everyone. So happy to have you join us today for our next episode of our Safe Kids Central California Lunch and Learn. Today's topic is youth sports. I'm Dr. Hailey Nelson. I'm a complex care pediatrician here at the Charlie Mitchell Clinic at Valley Children's Hospital. And our special guest today is Carlos. He's one of our excellent nurses, and I'm going to have him explain a little bit more about what he does at Valley Children's and why he wants to talk to you about how to keep your children safe while playing sports. Carlos, thanks for joining us.
Well, thanks. I appreciate being here. And yeah, I've been around Valley Children's for a little while, 34 years this year. And I'm the trauma coordinator, which means I oversee our trauma program. So those are all the kids that get hurt. And we have a very extensive injury prevention program that you're probably already familiar with. But what we like to do is focus on certain things at certain times of year. And this happens to be the time of year where a lot of kids are really heavy into getting into their sports. And so we'll talk a little bit about that today.
Awesome. Great. Yes. I know it's been an issue this year with COVID, and some children didn't have their teams participating last year. So now we're trying to kind of get back into it. If you are a parent and watching this, there are recommendations from the American Academy of Pediatrics. We're going to include that link below that talks about the risks when we're looking at some COVID precautions. But Carlos, do you have any tips for parents when it comes to kind of figuring out the safety pandemic-wise with sports?
Well, there are still recommendations, but thankfully our communities are beginning to open up, and so follow your local jurisdiction's recommendations, and certainly from the CDC. But the current areas, especially within the Central California area, are that communities are beginning to open up, and we're starting to see sports programs coming alive again, which is an absolute wonderful and good thing. We know that we have upwards of, about 38 million kids that are involved in sports across the country. Again, that's a wonderful thing. And here at Valley Children's, we strongly encourage having kids get out, be active, and get involved with organized sport.
Yeah. So physical activity, it is good for your body. It's also good for your mind. And so getting some sunshine, getting outside is really a great thing. Also that team participation, so getting to interact with your peers, and then navigating that now for how we certain sports are set up better than others for being able to maintain that social distancing, being able to wear your mask, and doing some pre-planning too for having your child like bring their own water bottle, for example, so you're not sharing, drinking fountains and things like that.
That's absolutely right. So one of the things that we do like to really emphasize is the importance of a pre-sports physical. This really should be done annually. I know that when schools are in session, oftentimes they'll hold an event night where they'll have a couple of physicians or pediatricians come in, and they'll do scores of kids at one time. However, what we really recommend, the best practice is to have your own pediatrician take a look at your child and do your own sports physical with your pediatrician. The reason is that your pediatrician knows your child much better, and you and the pediatrician team up and can come up with a plan. One of the things that's very important is to come up with an emergency care plan that most coaches, most organized sports will have a form of some sort where you write that plan down, who to contact in the event of an unfortunate injury, and that sort of thing, who your physicians are, and so on and so forth. But one of the other things that's really important about having your own pediatrician conduct the pre-sports physical is, especially if they have a pre-existing condition such as juvenile diabetes or arthritis or asthma. And we know that even any of those things or any other pre-existing condition, most often kids can still participate in organized sport. And we do encourage that. But so long as you have a safety plan out there, for example, with the use of asthma, and of course in our Central Valley we have, unfortunately, we have several bad air days throughout the year, and that we have to be cognizant of. Well, what are we going to do about that is part of the thing that you can discuss with your pediatrician, having an inhaler, perhaps even taking a rescue inhaler beforehand. Structure it with your pediatrician specific to your child.
Perfect. Yes, that's a great plug. As a pediatrician, I want to see my patients. I want to help them be active, but certainly getting that follow up. And I know for a lot of families, it really has fallen off. So that there have been missed appointments during the pandemic as everyone's been staying home. So as you're looking to get back, making sure that you add to your to-do list, calling your pediatrician, getting your child their sports physical. And it's a great time to also check up on other screening that they might be due for. So get their eyes and ears checked. Are they due for any vaccines? All that good stuff that happens when you come see your pediatrician. So getting the sports forms filled out, and so we can maximize their health and get them out and playing again. I love it. So what are some of the things?
Make sure to take a list of questions with you, especially if your child is about to play sports. You have questions. Write those questions down, and just refer to that with your pediatrician.
Excellent. Yes, I love it when parents come in. Bring me that checklist. Let's go through it, and I make sure that I get it all answered. Now, in talking about sports in the Central Valley, so you mentioned one thing, which is our air quality here not being great, and so those poor air quality days and being able to help our asthmatics out. But the other thing is the heat. So it is pleasant outside right now in Fresno, but we know that it's going to get hot. So what are the recommendations for hydration so that we keep our athletes well hydrated and we avoid kind of issues with that?
Well, you had already mentioned one in light of COVID, and it's still a good idea even without COVID is to make sure your child has plenty of drinking water that they take in their own containers. I have 4 sons. Some of the pictures are behind me, but all of them played sports, and my goodness, I mean, they were just drinking out of anything. But in that, which wasn't the best practice. The best practice is to make sure you have your own water container, but have a good-sized water container, because it's truly important. Hydration is truly, truly important, not only for the young athlete, but for all of us. So the recommendation essentially is that with regards to hydration is to hydrate at least 30 minutes before your sporting activity, every 20 minutes during the activity, and then for an hour afterwards. So 30, 20, 60 is essentially the number of minutes that is recommended. Now, what you hydrate with, water. Okay, so water is first and foremost, of course, and I think most people will understand how smart that is. Definitely stay away from the energy drinks, what are called energy drinks. High in caffeine, detrimental to health, high in sugar content. So definitely stay away from those. Do not recommend those for kids at all in any way, shape, or form. Sports drinks, okay. Sports drinks also have a high sugar content, so you do have to be mindful of that, but they also include some electrolytes that our bodies can use. If you're looking for something to replenish electrolytes, and this is not a plug for any particular product, but you see the 2 guys in the uniforms behind my right shoulder over here. Those are my 2 younger sons who are in the military. What they use is Pedialyte. Just getting an electrolyte drink from Pedialyte or any of the other brands, or even a generic form, helps with rehydration and replenishing the electrolytes that our body loses. Now, the importance of hydration, we can see, and we do see several kids, not only during the hot months, but also during the cold months, that are dehydrated. Usually the signs and symptoms of dehydration are that a headache will develop, maybe some nausea. Those are more the milder symptoms, but the heavier symptoms can certainly come into play, such as muscle fatigue. If you're watching your young athlete out in the field, on the pitch, on the diamond, on the court, and you're starting to notice that they're slowing down and sluggish more so than what they normally are, it could be simple hydration that they need. You see it in professional athletes and college athletes that they often will be hydrating during a game. Muscle fatigue, so also muscle cramps and one way to stave off muscle cramps is certainly to remain hydrated, especially with some of those electrolyte solutions. That should help. And then it can get even worse to the point of becoming irritable or confused, where you see some mental alertness diminish. And then you're starting to get into the danger zones, in which case you really need to pull the child off the field and get them cooled off and hydrated. So the rule of thumb with the every 20 minutes is if you're out and about, usually the referees are pretty cognizant nowadays about giving the kids a sports or a water break, taking 10 gulps of water for every 20 minutes of activity. That includes kids that are outside playing on the playground or out in the front yard or in the park or whatever. Take a break from the activity, 10 gulps of water every 20 minutes and get back at it.
I like it. The tangible numbers, I think, make it easier to hang on to. So, okay, 10 gulps, 20 minutes, and you can kind of set the timer and be watching for that. And then if you are seeing those signs, so you mentioned kind of the scary stuff and the things we worry about, which is why we're here talking about how important hydration is. So if your child is going from, feeling thirsty to now, as you mentioned, the muscle aches, and then it goes on to the irritability, confusion, that's really a time where you need to seek medical attention for your child.
That's
so
right.
there are some times that certainly during sports activities, so if you're worried about heat stroke and heat exhaustion, that is a time to seek attention. What are some other things that we want parents and coaches to be mindful of, and when to kind of call 911 or bring their child in?
Well, anytime that there's any kind of neurological type of symptoms, such as, a change in mental status, confusion, irritability, or even getting into the harder areas of somnolence, where a child maybe lights are on but nobody's home sort of thing, where they're ultimately confused or not able to answer questions that you may be posing to them, or they look at you not recognizing you. Certainly, anytime there's a loss of consciousness, absolutely must have medical attention for that, whether it's from a collision or simply from a fainting episode, what we call syncope. It could be, especially if that has never happened before, you definitely want to have medical attention. Anytime that there's overt bleeding, where, especially if it's uncontrolled bleeding, you definitely want to have a 911 call with regards to that. If you suspect that there's a spinal cord injury, I've actually been out on a pitch on a couple of times where there was a suspected spinal cord injury, where we had to have an ambulance come out. I had to run out in the field. It was very dramatic, but fortunately for the child, both those kids, they were okay. But nonetheless, you don't know that at the moment. So those are probably the most severe types of symptoms. Not being able to breathe, obviously, is another one. If you have a severe asthma attack and the rescue inhalers aren't working, definitely got to have some intervention with regards to those situations.
Okay, so reasons to call the doctor, or reasons to call 911. And we talked at the beginning about reasons to go see your doctor. So if we do the pre-sports physical and we're prepared and kind of have our game plan in place, hopefully we don't see any of those reasons to have to come back in. So being what we're looking for. Do you have any other tips you wanted to share with families today as they're considering sports participation for the summer?
Be not afraid. Don't be afraid. Get out there. Get your kids out there. Have them participate. There is going to be injury. Expect that. It's not going to be severe most of the time, but there is risk. Every time we walk out the front door, there's risk. But you get your kids involved in sports. Let them get out there and burn off that energy that the youngsters have. They'll have the risks and benefits. The benefits are much greater than the risks. So don't be afraid. Get out there.
Get out there. I love it. I know I brought my soccer ball today. So getting outside, just getting to play with my kids and enjoy the nice weather that we have here.
Yeah.
So thank you so much for joining us. We've got our tips up in terms of injury prevention, really emphasis today on that hydration piece too. So if you are listening along and you're wondering, you want to be drinking enough that you are peeing clear. So if your pee is yellow, that you are showing signs of dehydration. So hydrate early and often, and then remember that 10 gulps for every 20 minutes while you were out there. And then when to call 911. Thank you so much, everyone, for joining us today. Please like and follow us on Safe Kids Central California. You can always follow our website as well. And then we will see you back here next month. We've got some other episodes lined up. So I think we're doing some water safety and some other fun things in May. But happy to have you here today. Carlos, thanks again for joining us.
Oh, it's a blast.
All right. Bye, everyone.